Opioid overdose is a major problem, not just in the state of Idaho, but across the country. As the first person on site, you can potentially save a life by giving an opioid reversal drug called naloxone. Prescription opioids are drugs that are used to treat pain. Some common prescription opioids include hydrocodone, oxycodone, morphine, and methadone. Normally, these are prescribed by a doctor or other qualified healthcare provider. Yet there are also illegal opioids such as heroin. Opioids are very effective at treating pain, but they're also very powerful and easy to misuse or abuse, which is why cases of opioid overdose are on the rise. This video will help you recognize an opioid overdose when you see one, know how to help the victim, give the potentially life-saving drug naloxone, understand how Idaho law protects you, and learn where to go for more help and information. An opioid overdose can occur for many reasons: taking the drug by accident, interaction with other medications, a sudden increase in opioid dosage, or in some cases deliberate misuse. People taking opioids can also overdose if they have ingested the wrong dose or misunderstood the directions on how to take the drug, if they start taking the opioid at the same dose after a long break because their body's tolerance to the drug has gone down, or if they have an underlying illness. When someone overdoses on an opioid, their breathing can slow or stop altogether, which may eventually lead to death. Suspect an opioid overdose if the person appears unconscious or barely conscious, they do not respond to a loud voice or prodding, they have slow or shallow breathing or have stopped breathing completely, they're choking or sound like they're snoring or gurgling, their lips or fingernails are turning blue or gray, they have pinpoint pupils, or they're vomiting or foaming at the mouth. Giving naloxone to a person experiencing an opioid overdose could save their life, and this video will show you how to do it properly. Naloxone, sometimes known as Narcan, can temporarily reverse the effects of an opioid overdose. When used early, it can help restore normal breathing. The two most affordable and accessible forms of naloxone are the one-dose nasal spray and injection by syringe. In an overdose situation, the first thing you should always do is make sure the scene is safe. Next, try to rouse the victim by shaking them, shouting, or by rubbing their chest with your knuckles. If needed, get the person to the ground safely. Check the victim to see if they are breathing or gasping for air, and check for a pulse at the same time. Step 3, call 911 or ask someone else to call while you tend to the victim. Now is the time to get the naloxone ready. If you think someone has overdosed on an opioid, give them naloxone as soon as possible. To give naloxone in a single-step nasal spray, hold the device with your thumb on the bottom of the plunger and 2 fingers on the nozzle. Place and hold the tip of the nozzle in either of the victim's nostrils until your fingers touch the bottom of their nose. Then press the plunger firmly to release the dose. To inject naloxone with a syringe, be sure to choose one with the needle at least 1 inch long. Open the cap of the naloxone vial, then remove the cap on the needle and insert the needle into the vial. With the vial upside down, pull back the plunger and draw up 0.4 milligrams of naloxone, which is all of the medicine in a single-dose vial. With a syringe, naloxone is best injected into the upper arm, thigh, or buttock. Insert the needle at a 90-degree angle through the clothing if necessary. Then push the plunger all the way down to inject the full dose. Victims will normally respond to naloxone within 3 to 5 minutes, but don't wait. After you've called 911 and given naloxone, if the person has a pulse but is not breathing or only gasping, administer rescue breaths. If you don't feel a pulse, begin CPR based on your level of training or follow dispatcher instructions. To give rescue breaths, lift the victim's chin and tilt their head back to open their airway. Pinch the victim's nose to close their nostrils, keeping the airway open. Take a deep breath and seal your lips around the victim's mouth, preferably with a CPR barrier mask. Give them 1 breath every 5 to 6 seconds. If the victim has not responded to the naloxone 3 minutes after you gave it, give them a second dose and continue rescue breathing. Once you've completed the previous steps and the victim is breathing on their own, place them in the recovery position, but be prepared in case the victim becomes agitated or angry as they recover. Sometimes victims will show side effects when an opioid overdose is reversed. These side effects can include vomiting, diarrhea, anxiety, or confusion and agitation. The victim may threaten, yell, or even try to hit you. They may also be confused and want to use drugs. Occasionally, victims will appear to have a seizure. Naloxone may be effective up to 90 minutes, but this can vary. If the effects start to wear off before medical help arrives, or if the victim continues having difficulty breathing, be prepared to give them more naloxone. A person may be at greater risk for an opioid overdose if they have overdosed in the past, have combined opioids with alcohol or sedatives such as Valium, have restarted opioid use after a long break, or after being released from prison, the hospital, or a rehab facility, for example. People are also at a greater risk of an overdose if they are using heroin or fentanyl, are taking higher than usual doses of prescription opioids, or if they have a medical condition such as lung disease or sleep apnea. The best way to deal with the problem of an opioid overdose is to prevent it from happening in the first place. Here's how. Take the lowest dose of prescription opioids needed to control your pain and never more than prescribed. Don't mix opioids with alcohol or other sedating medications such as benzodiazepines or muscle relaxants. These combinations can increase the risk of an overdose and should be avoided whenever possible. If you resume taking opioids after a long break, start at a lower dosage than before. Finally, never inject alone. Always store medications in a safe, secure place. Properly dispose of any unused medication. Teach family and friends about how to respond to an opioid overdose. And finally, be sure to ask a close family member or friend to carry naloxone if you are at risk for an opioid overdose. In Idaho, anyone with a valid reason can ask for a prescription for naloxone from a physician, physician's assistant, nurse practitioner, or pharmacist. The naloxone does not need to be intended for your own use. If you receive a naloxone vial, make sure you also receive a needle and syringe. By the way, you should know that the Idaho Good Samaritan law protects those who administer naloxone from liability. The law also protects those who overdose or seek help for someone overdosing from being charged with possession or use of a controlled substance, but the law does not protect against drug trafficking or distribution charges. Naloxone has a shelf life of between 18 months and 2 years. Always store the drug in a secure location out of reach of children and away from extremely hot or cold conditions. Plus, make sure you tell others who may be able to assist in an opioid overdose situation where the naloxone is located. It's also very important to properly dispose of any unused naloxone and injection instruments. Spent nasal spray and naloxone vials can be put in the household trash. Used needles should be safely managed to prevent injury and disease transmission. Now, let's review the steps you should take using naloxone to help an opioid overdose victim. First, attempt to rouse the victim. Call 911. Give naloxone. Check for pulse and breathing. If the victim has a pulse but is not breathing or only gasping, start rescue breathing. Repeat naloxone administration if the victim has not responded after 3 minutes. Once the victim is breathing on their own, place them into the recovery position. Monitor the victim until medical help arrives. If there is no pulse, start CPR and continue until medical help arrives. For more information on opioid use, misuse, and abuse, or for assistance in getting treatment, call 211 or talk to your healthcare provider. You may dispose of unused opioid medications at a prescription drug take-back location. To find a location near you, visit Idaho's Office of Drug Policy website. If you or someone you know is interested in receiving treatment, recovery support services, or medication-assisted treatment for an opioid use disorder, call BPA Health at 800-922-3406 for a screening. If you haven't recently, consider taking a CPR class. Thank you for watching this video.